We have here Dr. Daisy Corrales Diaz, Director for the Inter-American Center for Social Security Studies, Maestro de Inter-American, Maestra Paula Álvarez, Coordinator of the project of the Interagency Project for the Women in Mexico from the Office of International Labor Organization in Cuba. Dr. Gabriel Garcia Ornelas, Chief of the Research from the Mexican Institute of Social Security. Dr. Irma Juarez from the Inter-American Center for Social Security Studies, to Dr. Wendola Bravo Zurita, Academic Coordinator for the Inter-American Center for Social Security Studies, and Dr. Javier Garcia Rivas, Specialist for the American Commission on Occupational Risk Prevention for the Inter-American Center for Social Security Studies. We ask for welcoming words of Dr. Daisy Corrales Diaz, Director of the Inter-American Center for Social Security Studies. Good evening and welcome to all the colleagues. We welcome all the institutions represented here and all the colleagues working at the Inter-American Center for Social Security Studies. For us, it's a pleasure in the name of General Secretary Belarca, which cannot accompany with us because he's in a conference. Today we have two celebrations, one referring to the World Day for Safety and Health Security at Work, that it is an iconic celebration for our center because we will celebrate all the advancement that we have had on social security studies and that we can consider a motor for the humanity. We are all very conscious of what it means, this topic in human rights. And if we see historically, from Genesis, it appears the definition of what is work. And lately, throughout history, it has been very important institutions as the creation of occupational medicine and all the possibilities, alternatives, and knowledge that has been generated and that we can share today in this very important panel. We are in a time that after pandemic, we have had a series of situations that we put here to analyze. There have been some important challenges. The first one, to guarantee the access of all the workers in social security, as well to make effective all the human rights in the work environment. It is very important to consider all the development that has been done in occupational health, as well as the integral attention of health for the workers. We have to consider all the scenarios for health promotion, prevention of diseases, the rehabilitation as well, that is very important in occupational health. And in this way, make all these advantages in the health system have been applying to the occupational environment. It is very important to recognize the new concepts on work, for instance, coverage on these communities, and also to take into account all the rights that we can acknowledge for all these workers. The action that is proposed from all the international is to have an effective dialogue between all the parties, all the stakeholders. We know that all the occupational health has been done in in a lot of stakeholders, that is state, workers, employees, but all the, and we have to have an efficient dialogue to face dialogues, to face problems, to see the needs from the state and from the employees. The world scenario, as I told you, it's complex. The WHO declared March 11th on 2020 COVID as a pandemic, and throughout these years, as it has been declared, classifying as an occupational disease, as an increase and a very impressive increase on the rate of morbidities. In this way, it is important to consider all the challenges that from the conference we face in occupational areas. We are celebrating the 80th anniversary of this conference, and you can check all the declarations throughout these 80 years where we have into consideration all the related with work and social security, always hand by hand and working together for the improvement of occupational health from workers' rights. And one special theme is pensions. In this way, we are today with these very important scenarios, thanking all these authorities that are coming with us and participating with us, and that we are also workplace of social security. And we have indeed to send a message, an important message. On social security, we have two hats. In the first one, where we promote social security in the countries and within all the dynamic of enterprises and companies and workers, and a lot of times we visualize it as if we are promoters of a theory, but the call is for all the institutions of social security that are listening to us right now. We have to see within ourselves so we can actually apply this principle of social security. So all the rights of workers and occupational health, we have to have a dignified work environment and promoted by the institutions. So we have to predict with the example. That would be my words. Thank you very much for being here. We thank Dr. Corrales for her intervention. So we have, we'll ask some words for Roberto Martinez. Thank you very much. Good afternoon. I thank the invitation by Dr. Daisy Corrales that astonishingly should direct our Center for Social Studies. We are really flattered to have here the presence of Maestra Paula Alvarez from WHO and the presence of Dr. Gabriel Real from Mexican Institute of Social Security, and all the colleagues that are with us. Today, we are gathered for the World Day for Safety and Health at Work, and the webinar starts with a focus of acting together. All the stakeholders in social security understood as an important aspect of dignified work, as well as health, as one of the main issues in this time. It is very good that the ILO is with us right now. tragically, around 2.7 deaths are produced in the workplaces, from which 2.4 are related with occupational diseases. It is tragical nonetheless. There is no way of minimizing this big impact on the risks at work of safety and health at work. Taking into consideration of this tragedy for the family of the workers, we see that there are some very important costs of those who create these sources of work. Employees have to pay important indemnizations, productivity stops, also the costs of readaptation of the workers. It's important. This implies also an enormous cost that all the society as well as the employees has to burden. A very great deal of the GDP is lost, and it's very important for the global economy. So the response for the ILO, as well as all the international organisms, as is the Inter-American Center for Social Studies. We have to feel and contribute the elaboration of new tools to homologate the efforts for a lot of countries, especially from the American and continent and the Caribbean, in order to advance together firmly and quickly, and in order to strengthen all these fundamental aspects on safety and health as a dignified work. With all the work of our research center, we are going to some efforts to help and add strategically all the work between all the stakeholders, so we can give more safety and health at the work environment, including new ways of working. As Dr. Corrales said, we are congratulate ourselves to be inaugurating this webinar and to work in a permanent job. That is really fundamental for us. Thank you very much for allowing me to give these words. Thank you very much, Maestro Martinez. As well, we ask the intervention of Dr. Graciela Gil Montalvo remotely. She's president of the American Commission on Occupational Risk Prevention of the Inter-American Conference of Social Security. Thank you very much. Good afternoon. The American Commission on Occupational Risk Prevention, CAPRT, welcome you all that in this scenario that promotes to be in the campaign, acting together to build a positive safety and health culture, commemorating the World Day for Safety and Health at Work, as we have said. The importance of all this is that it is centered, it is a call to strengthen the participation and dialogue of all the society, defined by the ILO as all the negotiations that include information between the stakeholders, governments, employees, and workers. But maybe the most important thing is that this organization highlights it as a key element, not only for economical growth, but as social justice. One of the strengths and opportunities of our countries is that the majority, we have a regulatory framework where even in a lot with a mandatory character, they are, we have to, some decades ago, there is a tendency to add to international regulations and integrate it to each company. For example, the OSAS, and I am talking all the preventionists that are connected today with us, the ISO 40,003, 40,001 that already incorporate the psychosocial risks as part of risk evaluation. For its organization, all these rules make emphasis precisely in the participation and dialogue of all the society, being indispensable in all the process of management. Be planifying, execution, evaluate, risk assessment, actuation. Another strength that we have, that our countries have, and we see it as an opportunity, is that we have tools to strengthen these aspects, is that the majority are within its regulations. For example, these tripartite events. For example, in my country, it's an, but also the majority of the countries have bipartite regulated commissions, paritary committees of social security at work. And others included the figure of delegated. Very important to focus in a strengthening of a preventive culture for small, medium, and big companies. And all this with the particularities of each country. Another strength, if we see it from the standpoint of view of those countries that are member of the ILO, is that they have support through all the agreements. For example, the agreement 155 agreement, it's 164 recommendation, the specific recommendations on social dialogue, the ones who talk about fundamental work rights, among others. Of course, in the different levels. We cannot live outside the stakeholder role linked with the results of the management of health at work. I mean the professional and experts on safety and health at work who assist and accompany in all the preventive management, in all the programs, in assessment, in capacitation, actually recognize their role that they have played at the beginning of the pandemic, when they have to reformulate and actualize their prevention programs, that without them we couldn't have fight this pandemic, and that precisely has strengthened this professional of health safety at work. We have tools, but in order to build a culture of safety and health at work, we need employees and workers integrated part that participate and promote workplace environment safety and building prevention culture, as we have mentioned, has as objective the increase of the productivity as, as well as the increase of workers' rights. This week for prevention is really important. Each year we wait this topic to support the ILO in order to focus and propitiate the development of preventionist culture in our region. We hope for all those participants that this journey has very meaningful for all of you. Thank you very much. We thank Doctora Gil Montalvo for its collaboration. En la mesa principal para después dar inicio con los trabajos preparados para el día de hoy. Maestra Paula Álvarez Reparaz. Protección social para las mujeres en México, de la Oficina de la Organización Internacional del Trabajo. Por favor, unas breves palabras. Please, a few words. Thank you very much. Good evening for all. I would like to tell you that besides I am the official of safety and health at work in Mexico and Cuba. It's a pleasure to be here with you. And as you have been saying, we are in the week of safety and health at work, very important week for all of us, for preventionists, and especially for ILO, because from our organization, we cannot guarantee decent work without existing a safety and health work environment for workers. This, as we were saying, we have centered today in the social dialogue regarding social safety and health at work. Why is it important? So we can adopt measures between governments, workers, and employees, and can make agreements that guarantee and sensibilize the society on the need that there should be a decent work, especially to have the conscience of safety and health and work should not be as an investment, as a lost money without benefits. Because every time that we guarantee decent work for all the stakeholders, it's going to be a winning for all the society. I thank you for the Inter-American Conference on Social Security, and especially the Inter-American Center for Social Security Studies, the invitation of this event. And when I start my speech, we will speak deeply on why is it important, this dialogue for a safety and health culture. Thank you very much, Maestra Álvarez. We ask also the intervention of Dr. Ornelas. Thank you very much. Welcome to this webinar. The name of Eder Garcia. We welcome you all. I would like to tell about all the changes here in the Institute has been as consequence of this pandemic. This has been changing the paradigm that we have up to today. From within the works that we realize that there has been more than 10 million people that have some vulnerability criteria. This is alarming, really. And safety at work was not taken into consideration. This had very serious consequences, 3.4 million capacities, and for a lot of work days lost. This was an impact for companies, for health systems as well as for workers. This makes us change what we are doing. This was a dramatic way of seeing how important was to have a healthy environment at work. These same stakeholders increase all the risks to have occupational disease and occupational accidents. The pandemic make evident all these risks and problems. This was a shaken for us and made us to change more to prevention, not only to classical risks, but all these factors that are contributing to that the risk be more serious. Acting together to build a positive safety and health culture, workers' health has to be involved all the stakeholders, employees, companies, and workers. We hope that this webinar has been really important for you all in order to generate a safety workplace environment. Thank you, Dr. Ornelas. To start this webinar, I will give the floor to Dr. Garcia Rivas, PhD in Public Health by the University of California. He holds a master's degree in organizational psychology by the Autonomous University of Morelos. He's a graduate student at the University of California, Los Angeles. He has been a professor at the Professor of San Martín de Porres, Peru, University of California, Autonomous University of Morelos, and CETIS University in Mexicali. He has more than 10 years of experience as a researcher in occupational health. He has more than 20 publications, including indexed scientific journals, book chapters, and specialized texts. He has been speaker at international events and consultant on psychosocial risk factors at work. He is currently a specialist of the Commission on Occupational Risk Prevention for the Inter-American Center for Social Security Studies and the Inter-American Conference on Social Security. In addition, he has been consultant and advisor to the Pan American Health Organization on work and health issues. Thank you very much, Carlos. Thank you very much for all the participants. It's a pleasure and an honor
estar en esta segunda edición
in this second
de la
edition,
conmemoración del Día Mundial
the
de la Seguridad y
commemoration
Salud en el Trabajo, celebrada
of the
por la
World Day for
gestión
Safety and Health at Work,
2020-2022 de la
celebrated by
Comisión
the
Americana de Prevención de Riesgos en el Trabajo, presidida
22
por la doctora
management of the
Graciela
American
Gil,
Commission on
de
Occupational
quien ya
Safety and
escuchamos sus
Health,
palabras.
chaired by Dr.
Damos la
Graciela
bienvenida
Gil.
a nuestras
We
autoridades
welcome
de
our
la CIS y del
authorities of
CIES
CIS and
aquí
CS,
presentes, igual que a nuestros
as well
invitados
as
e
our
invitadas
special
especiales.
guests.
Como bien mencionaba el doctor
As
Martínez,
Dr.
este día
Martinez
recordamos
mentioned,
a los
we
más de
remember
2
the more
millones de
than 2
trabajadores y
million
trabajadoras
workers
en
around
el
the
mundo
world
que cada año pierden la
who lose
vida
their lives every year
desempeñando sus labores o
or in
como
the course of the
consecuencia
work or as a
de enfermedades
consequence
relacionadas con el
of
trabajo.
diseases related
El
to work.
propósito de este
The
evento de
purpose
2
of this
días,
two-day event,
por cierto, mañana tendremos
tomorrow
la segunda sesión
we
a la
will have
misma
the
hora,
second session at the same
es el de
time,
compartir experiencias y
is to
discutir
share
qué podemos
experiences
hacer y cómo
and
podemos
discuss what we
contribuir
can do
los
and how
principales actores de
we
la
can
relación laboral,
contribute
es
the
decir,
main
los
stakeholder,
trabajadores, los empleadores
employments,
y el Estado,
workers and
para
state
promover y
to
consolidar
prevent and
una cultura de
consolidate
prevención
an
de
occupational
accidentes
culture
para garantizar el
prevention
trabajo
to
decente.
ensure decent
Concepto,
work,
por cierto,
a
que ha sido
concept
adoptado
adopted
en la meta 8
in
de la
Goal
Agenda
8 of the
2030 de los Objetivos de
2030
Desarrollo
Agenda
Sostenible
of the
de las
Sustainable
Naciones Unidas.
Development
En
Goals
este
of the
sentido,
United Nations.
la
In this
CAPRT
sense,
tiene como objetivo contribuir
CAPRT
en la
aims to
investigación,
contribute with
con
research,
investigación, perdón, divulgación y
dissemination,
difusión del
and
conocimiento
diffusion of
por
knowledge
medio de eventos como
through
este
events such as this
y trabajos que se pueden
and works that
encontrar en
can
el
be found
micrositio de la
on our
comisión,
microsite,
vínculo que estaremos
of
compartiendo
which
con
we will
ustedes
be sharing the link
en el
in
chat
the chat.
del evento. Y también Colaboramos en
We
cursos
also collaborate
especializados en el
in
CIES a
specialized
cargo de la
courses
coordinación
at
académica
CS
dirigido por la doctora Irma
run
Juárez.
by academic
ejemplo, en
coordination
octubre
led by Dr.
estaremos impartiendo
Irma
el
Juarez.
curso
In October, for
Impacto de
example,
los riesgos
we will be
laborales en la salud
teaching the
mental de los
course Impact
trabajadores.
of
Toda esta
Occupational
información
Risk
la pueden
on the
encontrar en la
mental
página web
health
del
of
CIES.
workers.
Pero
You
bien,
can find all this
sin más
information at our
preámbulo,
web
y para
site.
respetar los tiempos de nuestros ponentes,
Without further ado, in order
cederé
to
la
respect the
palabra
time of the
a la maestra
speakers, I will
Paula
give the
Álvarez,
floor to Paula
de quien me voy a
Alvarez,
permitir
whose
leer su resumen
curriculum
curricular.
I will read.
La maestra Paula Álvarez es
Paula
licenciada en Derecho
Álvarez,
y
Maestra
licenciada en
Paula Álvarez
Administración y
is
Dirección
bachelor's
de
degree in
Empresas
Law
por
and
la
Business
Universidad Rey
Administration and
Juan Carlos
Management
de Madrid,
from the
en España.
Rey Juan Carlos University in
Maestra en
Madrid,
Seguridad de
Spain,
Salud en el
Masters
Trabajo
in
en las
Occupational
tres
Health and
especialidades de
Safety
Seguridad,
within the three
Higiene Industrial,
specialties, Safety,
Ergonomía
Industrial
y
Hygiene,
Psicosociología,
Ergonomics, and
aplicada
Applied
por la Universidad de La Rioja en España.
Psychosociology
Ha
from
desarrollado su carrera
University
profesional
de
en el ámbito
La
jurídico
Rioja.
laboral
She has developed her professional career in the
especializándose en
international labor
seguridad
law
social
field,
y en seguridad y salud ocupacional.
specializing in social
Ha
security and
trabajado como
occupational health
consultora
and safety.
especializada en
She has
seguridad
worked
y
as
salud
a
en el trabajo para
consultant
la Oficina de la
specialist
Organización
in occupational
Internacional del
safety
Trabajo
and health for
para
the
el Cono Sur
Office
de América
of the
Latina,
International
para
Labor
la Oficina de la OIT para América
Organization
Central,
for the
Haití,
Southern
Panamá
Cone,
y República Dominicana y
for
para
the
la
ILO
Oficina de la
Office
OIT
for the
para los
Central
países
America,
andinos.
Haiti, Panama,
Actualmente
and
es
the
coordinadora
Dominican
del proyecto
Republic.
interagencial
She's currently
Cerrando
coordinator
Brechas,
of
como ya
the
mencionábamos, protección
interagency
social para las
project
mujeres en
Closing
México,
Gaps,
para la Oficina de
Social
la OIT,
Protection for
para
Women
México
in
y Cuba.
Mexico
Maestra,
for
es un
the ILO
verdadero
office
placer
in
contar con su
Mexico and
presencia el día de
in
hoy.
Cuba.
Muchísimas
Maestra,
gracias
it's a
nuevamente
real pleasure to have you
por habernos
here.
invitado a la
Thank you very
Organización
much to
Internacional del
invited
Trabajo.
us.
Hablo en nombre de mi oficina. Para nosotros es un gran honor
For
poder compartir
us,
estos momentos
it's
con
a
ustedes
great
en una
honor
semana
to
tan
share
importante, ¿no? Que es la seguridad y la
this
salud en el trabajo.
moment with you all in this very important
Que de
week.
alguna forma a todos nos incumbe poner un
And
granito de
that
arena en todo nuestro trabajo para
it
poder
is important for
garantizar
all of us
esa
to work
seguridad
together
social,
and to
esa
guarantee
protección
the
y esos beneficios
social
para todas las
security
personas trabajadoras, pero también
and
para
all
los
the
altos
social
empleadores, ¿no?
protection
Y que
for all
podamos
the
llegar entre todos
stakeholders,
a un
so we
buen
can
camino que garantice, como estábamos
arrive
hablando
to
desde
a
un primer
good path
momento, el trabajo decente. Trabajo
and
decente que,
working
como
together for a
comentaba hace un
decent
momento,
work.
es uno de los puntos de los
Decent work
objetivos
is
de desarrollo establecidos por el Sistema
one
de
of the
Naciones
goals
Unidas.
established
Voy
by
a
the
proceder a realizar
Agenda
una ponencia. Esta
2030.
ponencia lo que
I'm
vamos a
going
hablar es del diálogo
to
social
talk
en
on
materia de
social
seguridad y
dialogue
salud en el
for a
trabajo.
safety,
¿Por qué es
for a
importante el diálogo
safety and
social?
healthy culture.
No solo voy a
Why
hablar
is
del
it
diálogo
important?
social, sino también de cómo este
Social
diálogo
dialogue.
social
I'm not going
le
only to talk
corresponde a las
about
diferentes
dialogue,
partes de
but
este ámbito
how
tripartito en el que
this
hablamos. Como sabemos,
tripartite
la Organización Internacional del Trabajo es un organismo
environment
tripartito.
is important.
Nosotros nos debemos a tres partes y trabajamos con tres
We
partes
work
diferentes: la parte gubernamental,
with
la
three
parte
parts:
empleadora y la
governmental
parte de los
part,
trabajadores. Entonces,
employee,
con estas tres partes lo
and
que
worker
queremos
part.
es poder trabajar para
With
poder
these
llegar a
three parts,
acuerdos
we want
y
to
vuelvo a repetir
work
nuevamente,
to
poder
make to
garantizar
have
este
some
trabajo
agreements
decente
and
en
guarantee
el
decent work
sistema y en el mundo en el que nos
in
encontramos.
the world that we
El
are
día
right now.
28 de abril, vuelvo a comentar,
April
es el Día de la
28th
Seguridad y la Salud
is
en el
the
Trabajo,
day
y este año la Organización Internacional ha tomado como
of
referencia
for
el
safety and
diálogo
health
social.
at work, and
Entonces,
this
esta
year
ponencia va a
we
tratar
have
sobre cómo fomentar el diálogo
the
social para una
participation and
cultura de
social dialogue
seguridad
to
y
build
de
a
salud.
positive safety and health culture. That is the topic of this year.
Ahora, perdón, teníamos un problema con la ponencia. ¿Cómo construir y mantener una cultura de prevención en
How to
materia
build
de
and preserve
seguridad
a
y
preventive
salud?
health and safety
Según el
culture?
convenio sobre el marco promocional para la seguridad y la salud en el
According
trabajo
to the
del año
agreement
2006, que es
on
el
the
convenio
promotional
número
framework for the
187,
safety and health
una
at work
cultura en la que
2006,
el
a
derecho a un
culture
medio
in
ambiente
which
de
the right
trabajo
to a
seguro y
safe and healthy
saludable se
working
respete
environment
en
is
todos los
respected
niveles, en
at
la que
all
el
levels,
gobierno, los
in which
empleadores y los
government,
trabajadores
employers, and
participen
workers
activamente en iniciativas
actively
destinadas
participate in
a asegurar
initiatives
un medio
to
ambiente de
ensure
trabajo seguro y saludable
a safe
mediante
and
un sistema
healthy
de
working
derechos,
environment through
responsabilidades
a system
y
of rights,
deberes ya bien
responsibilities, and
definidos, y
duties,
en la que se
and in
conceda
which the
la máxima
principle of
prioridad
prevention
al
is
principio de
given
prevención. Como
the
vemos,
highest
ya en
priority.
esta
As we
definición
see
del
in this
convenio
definition,
187 nos dice que
the
corresponde a diferentes partes
187
y que no solo
agreement,
existen derechos, también
we
existen
can see that
responsabilidades y
not
deberes
only
bien
we have
definidos.
rights, but duties and
Vamos a
responsibilities
hablar de
from
los
all the three
diferentes
parts.
niveles en los que nos podemos
We are going to
encontrar el
talk of the
diálogo
different
social.
levels
A
that we
nivel
can
nacional, el
have a
gobierno en
social
su
dialogue.
conjunto se
At the
compromete a
national
crear y
level, the government
mantener
as a
una
whole is
cultura de
committed to create
prevención
and
en
maintain
materia de
a
seguridad
preventive
y de
safety and
salud,
health culture,
garantizando que la seguridad y la
ensuring
salud
that
en el trabajo se
occupational
considere
safety and
una
health is
prioridad en la
considered a
agenda
priority
nacional.
on the
Se
national
asignan medios y
agenda.
recursos adecuados para
Adequate
aumentar
means
la
and resources are
sensibilización
allocated
general
to
acerca de la
increase
seguridad y la
the
salud en
general
el trabajo,
awareness
el
of
conocimiento de
occupational
los
safety and
peligros y
health,
los riesgos que
knowledge of the
conlleva, así
hazards
como la
and risks
comprensión
involved,
de su
as well as
prevención y de su
understanding
control.
their prevention
Mediante
and
el diálogo
control.
social,
Through
los
social
mandantes tripartitos
dialogue,
participan activamente en
tripartite
todas las etapas de los
stakeholders
procesos de
are
toma de
actively
decisiones
involved
en
in all
materia de
stages
seguridad y
of
salud en el trabajo.
occupational safety and
¿A qué
health
contribuye el diálogo
decision-making
social? A mejorar la
processes.
calidad de las políticas
Social
y las
dialogue
estrategias
contributes
de
to
seguridad
improve
y
the
salud en el
quality of
trabajo, a
occupational
crear un
safety and
sentimiento de
health
pertenencia
policies
y
and
de
strategies,
compromiso,
to create
facilitando su
a sense of
aplicación y que su
ownership and
aplicación
commitment
sea más
and
rápida y más
facilitating
eficaz.
their more effective
Esto sería a nivel
implementation.
nacional, pero a
This would
nivel
be
del lugar
at
del
the national
trabajo,
level. But
¿qué conseguimos
the
a través
workplace,
del
what
diálogo
do we
social?
achieve
El
through this
cumplimiento de
social
la
dialogue?
legislación sobre
The
seguridad y salud
compliance
en el
on
trabajo,
occupational safety
la
and health
integración de los sistemas de
legislation,
gestión, como
the
bien se hablaba al
integration
principio, de la
of
seguridad y la salud
occupational
en el trabajo
safety and
en la
health
estructura de gestión
management
general de la
systems
empresa, que
into the overall
forme parte
management
dentro de
structure
la
of the
gestión de la
company.
empresa. Y un cambio cultural para
A
lograr una
cultural
cultura
change to
positiva
achieve
de
a
la
positive
seguridad y la salud en el
occupational
trabajo.
safety and health at
La
work.
seguridad y la salud en el trabajo se
Occupational
considera
safety and
un
health
valor
at work
fundamental de la
is
empresa,
seen as a
integrado en todos los
fundamental
aspectos de
value
sus
of the company,
actividades.
integrated into
Comunicación y
all the
diálogos
aspects of its
abiertos,
activities
basados en
as
la
open
confianza y en el
communication,
respeto mutuo entre
dialogue
las
based,
diferentes contrapartes.
and mutual
Liderazgo
trust and
positivo en
respect.
materia de seguridad y salud
Positive
en el trabajo
leadership
por
on
parte de los
occupational
empleadores
safety
y
and
de la
health
alta dirección.
by
Y la
employees and
formación e
management,
información de
and the
todos los
training and
trabajadores para que
information
puedan
for all the workers
participar
in order to enable
activamente en
them
las
to
acciones de
participate
mejora en la
actively
seguridad y la
in
salud.
occupational safety and health at work.
El papel clave del diálogo social durante la crisis del COVID-19. Se ha
The
comentado también
key
al
role
inicio
on
de este
social
evento
dialogue
de que
during the
la
crisis
pandemia
of the
nos ha dejado reflejados determinados
pandemic
problemas
has left
que a
us
lo mejor ya
some
existían, pero no los
specific
teníamos tan en
problems
relieve como los tenemos en la actualidad.
that, are,
Y se ha
that were
demostrado que el
highlighted
diálogo
during the
social,
pandemic.
que hubiese
It
una
is
comunicación
demonstrated
abierta entre
that
las
the
diferentes
social dialogue
contrapartes, ha ayudado a poder
have
gestionar esta
helped
crisis
to
con el actor.
manage this
A nivel nacional, los gobiernos
COVID-19
que han dado
pandemic.
prioridad a
At
la
the national
participación
level, the
activa de las
governments that have
organizaciones de
prioritized the
empleadores
active
y de
participation
trabajadores en la
of
gobernanza de
employers
la
and
seguridad y
workers,
la salud en el trabajo,
organization
han sido capaces de
in occupational
desarrollar y aplicar
safety and health
colectivamente
governments have
leyes,
been able
políticas e
to
intervenciones de
collectively develop
emergencia.
and implement laws,
A nivel del
policies,
lugar de
and
trabajo,
emergency
la
intervention.
participación y el
At the
compromiso de los
workplace, the
trabajadores a través de
participation
los
of
comités
workers
paritarios de
through
seguridad y
joint
salud en el trabajo
OSH
y
committees
de
and
los delegados de
workers
prevención de
and the
seguridad y
preventionist
salud en el trabajo,
delegates
también denominados, han sido fundamentales en
have
la
been
promoción del cumplimiento,
fundamental in
así como en el
promoting
diseño y la
compliance as well as the
aplicación de
design
medidas
and
adecuadas y
implementing
eficaces adaptadas al
effective
lugar de
measures
trabajo y a las
tailored to the
necesidades de los
workplace and the
trabajadores
workers'
para
needs
eliminar los peligros o minimizar los
to
riesgos.
eliminate
¿Qué nos quiere
hazards or
decir? Que
minimize
el
risk.
papel del diálogo
So
social
the
durante la
role of
gestión de
social
la
dialogue
pandemia ha
during
sido
the
fundamental,
pandemic management
tanto a
has
nivel de
been
comités
fundamental
paritarios dentro de las
in
empresas,
the
entre
level of
trabajadores y empleadores,
parity
como a
committees
nivel nacional
as
en
well
las
as a
políticas
national level,
estratégicas de los
as
gobiernos en
in the
materia de seguridad y
national
de salud en el
policies
trabajo.
in occupational safety
¿Por
and
qué es
health at work.
importante
Why is it
exponer las
important
preocupaciones
to
relacionadas
expose
con la seguridad y la salud en el
the
trabajo?
preoccupation
¿Por qué debemos dar
related with
nuestras opiniones? ¿Por qué debemos
safety
debatir?
and
¿Por
health
qué
at
llegar a
work?
acuerdos?
Why should we
Vamos a partir de la
come
definición de
to
qué es el
agreements?
diálogo social.
What is
El
a
diálogo
social
social
dialogue?
comprende todo tipo de
Social
negociación,
dialogue
consulta o
comprises any form of
simplemente
negotiation,
intercambio de información
consultation,
entre los
or
gobiernos y
simply
los
an exchange
representantes
of
de los
information
empleadores y de los
between governments
trabajadores
and
sobre
representative of
temas de interés
employers
común
and
relativos
workers
a políticas
regarding
económicas y sociales.
common
El
interests
diálogo social puede ser de
in
diferentes
economic
formas. Puede ser
and social
informal o
policies.
institucionalizado
Social
y a menudo
dialogue may
puede
be
ser ambos a
informal
la vez.
or
Puede tener lugar a
institutionalized or
distintos
often both
niveles,
at the
tanto
same time.
internacional como nacional,
It
como
can take
regional,
place at different
local o
levels,
simplemente en el lugar de
international,
trabajo,
regional,
implica a
national,
los
local, or at
interlocutores
what
sociales de diferentes
workplace
sectores
level.
económicos, de un
It
mismo
involves
sector
the
o de una
social
misma
partners from
empresa o
different
grupo de
economic
empresas.
sectors,
Como ya
from
veremos
the
más
same
adelante, esto lo
sectors,
veremos
or from the same
en
company or
función
group of
del
companies.
diálogo que se llega a cabo. más a nivel internacional, más a nivel
This
nacional,
depends
de
on
comisiones
the
consultivas,
different
o
levels,
simplemente en reuniones
whether
en los lugares de
international,
trabajo,
national
donde los
levels,
trabajadores puedan
or
exponer
at
cuáles son sus
workplace
preocupaciones y los
levels.
empleadores puedan tener en cuenta estas
So
circunstancias.
the employees can take into
Existen diversas
consideration the
formas de
workers' need.
diálogo social.
There are
El proceso
different
tripartito,
ways of
que es
social
el que estaba
dialogue.
comentando desde un
The
inicio y es el
tripartite
objetivo de la
process,
Organización Internacional
which
del
is
Trabajo,
the
se realiza
aim
con el
of the
gobierno.
ILO.
Normalmente suele
It
ser
is
con los ministerios de trabajo
organized with
u
the
otros
government,
ministerios que
with
se encuentren
the
interesados
Minister of
como parte oficial
Labor,
del diálogo.
especially
Existe
as
el
an
proceso
official party
tripartito
of the
plus.
dialogue.
En este caso,
The
es cuando se abordan
tripartite
temas que
plus
van más
process,
allá del mundo del trabajo,
it is when it
con
is
actores que
address
representan
issues beyond the
preocupaciones
world of
e
work,
intereses
with
específicos en la
stakeholders
sociedad.
represented
Y
specific
tenemos las
concerns
relaciones
and
bipartitas,
interests of
que son
civil
entre los
society.
trabajadores y la
We have
dirección,
also the
entre organizaciones
bipartite
de
relations
empleadores y
between
de trabajadores.
workers and management,
Dentro de
or
estas
between
relaciones
employers
bipartitas
and
tenemos la
workers'
negociación
organization.
colectiva,
We
que
have
se da en
the
todo el
collective
marco en donde se
negotiations,
hagan reuniones con
where
los
all
representantes de los trabajadores,
the
con los representantes de
representative
los empleadores
of employees
y
and
con los
workers
organismos
take
gubernamentales
place, as
que se
well
estimen
as with
necesarios para poder
the
abordar
government,
condiciones de seguridad y de salud en
to
el
talk
trabajo.
about
Y además
safe
también
and
tenemos
health
la
conditions at
cooperación en el
work.
lugar del trabajo. En este caso
We have
puede
the
adoptar diversas
cooperation
formas, desde el intercambio de información hasta la
workplace,
consulta o tomas de decisiones conjuntas.
as well as the decision making.
El diálogo social es un elemento fundacional de la
Is a
Organización Internacional del Trabajo.
foundational
Es algo que
element
nos
of
viene desde nuestras
the
raíces. La
ILO.
estructura tripartita de la
The
Organización
ILO's
Internacional del
tripartite
Trabajo
structure
permite que los
enables
empleadores, los trabajadores y
employers,
los
workers,
gobiernos
and governments
participen en la
participate
toma de
in
decisiones
decision making
sobre asuntos laborales
on
internacionales
international
con
labor
objeto de
issues,
promover
with
la
the aim of
justicia social
promoting
y el
social
trabajo
justice
decente para
and
todos.
decent
El
work for
diálogo
all.
social está
Social dialogue
establecido en
is
la
embodied
Constitución de la
in the
Organización
ILO
Internacional del
Constitution
Trabajo y en prácticamente todas
and in
las normas
practically
internacionales de
all
trabajo
international labor
como
standards
método clave para
as a key
lograr las
method for
decisiones
achieving
sostenibles y las relaciones
sustainable
prácticas
decision
en el
and
lugar del
peaceful
trabajo.
workplace
Se pueden
relations.
nombrar algunos
There are
convenios
specific
específicos que
conventions
tenemos
that
en
we can
relación
name
al
related
diálogo social.
social
En él nos
dialogue. For
encontramos el
example,
convenio sobre la
the
consulta tripartita, que es el
tripartite
convenio número
consultation,
144, el
number
convenio sobre la libertad
144,
sindical y la
the
protección
freedom
del
of
derecho de
association and
sindicación, que es
protection
el
of
convenio
the right to
87,
organize,
el convenio
the
sobre
Convention
derechos de la sindicación y la
87,
negociación colectiva, el convenio 98.
the
Ambos
98
convenios
agreement,
son fundamentales. Además,
which is the
también
right
tenemos el
to
convenio
organize
sobre
an
la
collective
negociación colectiva, que es el número
negotiation.
154.
The
¿Qué
150
queremos decir con todo
convention, that
esto?
is
Que,
the
como he
collective
comentado al
negotiation
inicio, es un elemento
convention.
fundacional de la
It is a
Organización Internacional del Trabajo.
foundational
Todas las
element
decisiones
of
que
the
se
ILO,
adoptan
all the
dentro
decisions
de nuestra
adopted
organización
from within
tienen un
our
carácter
organization
tripartito. Por
has
eso
a
forman parte
tripartite
de elementos
character.
fundamentales de nuestros convenios.
That's why
La
it is so
Declaración de la
important to have
Organización
them in our
Internacional del Trabajo sobre la
agreements.
justicia
The
social
ILO
para una
Declaration on
globalización
Social Justice
equitativa
for
en
a
el año
fair
2008 y la
globalization
Declaración del Centenario
on the
de la
year
Organización Internacional para el Futuro
2008
del
and the
Trabajo en el
ILO Centenary
2019
Declaration
reiteran la
on the
importancia del
future of
diálogo
work
social
of
para construir
2009
una conexión
19
social y una
reiterate
economía
the
productiva.
importance of social dialogue in building social cohesion
La
and a
participación y la
productive
consulta en el
economy.
centro de las
Participation
normas
and
de la Organización
consultation
Internacional
in the
sobre
center
Seguridad
of
y
the
Salud en el
normative
Trabajo.
of
Hasta
the
ahora he venido hablando
ILO
de lo que es
on
el
social
diálogo social con un
security
carácter más general, que lo
at work.
podemos vincular a todos los ámbitos laborales. Pero ahora vamos a centrarnos en lo que es la
Let's
seguridad y la salud en el
focus
trabajo,
on the
ya que
occupational
nos
safety and
encontramos en la
health
Semana de la Seguridad y la Salud.
in the
¿Qué
framework of
convenio
this
tiene la
celebration.
Organización
What
Internacional del Trabajo donde
conventions
resalte la importancia de este
ILO
diálogo
has
social en
where
seguridad y en salud en
it
el trabajo?
highlights the
Tenemos
importance
el
of
convenio
this
sobre
social
seguridad y
dialogue?
salud de los
We have
trabajadores
the
de
Occupational
1981, el convenio
Safety
número
and Health
155,
Convention of
que
1981
insta a poner
of
en práctica una
number
política nacional de
154
seguridad y
that
salud en el
implement a
trabajo
national
formulada,
occupational safety and
aplicada y
health
reexaminada
formulated,
en consulta
implemented,
con las
and reviewed in
organizaciones más
consultation with the
representativas
most
de las personas
representative
empleadoras y de las
organizations of
personas
employers and
trabajadoras,
workers,
que tengan en cuenta la
which take
comunicación y
into
la
consideration the
cooperación en los
communication,
diferentes
cooperation
niveles
at
y
different
que
levels,
precise las funciones y
and that
responsabilidades
specify all the
respectivas en materia de
functions
seguridad
and
y salud en el trabajo
responsibility
de
of
las
occupational
autoridades públicas, los
safety and
empleadores,
health
los
of
trabajadores y
the
otras personas
public
interesadas,
authorities,
teniendo
employees,
en
workers,
cuenta
and other
el
persons
carácter
involved,
complementario de
taking
tales
into account
responsabilidades. Además,
the nature of these responsibilities.
Uno de los convenios más
This
fundamentales en
convention,
materia de seguridad y salud en el trabajo,
that is one of the most
establece que las
fundamental,
disposiciones necesarias a
established
nivel
that the
de
necessary
seguridad del trabajo
arrangement at the
para
workplace
permitir que
level
los trabajadores y sus
enables
representantes
workers and their
cooperen con los
representatives
empleadores en
to
el ámbito
cooperate
de
with the
seguridad y salud
employers
en
on
el
the
trabajo,
field of
proporcionar
occupational safety and
información
health,
adecuada y
provide
formación
adequate
apropiada
information
y
and
permitir que todos los
appropriate
trabajadores o sus
training,
representantes estén
enable
habilitados
all
para examinar
workers
todos los
or their
aspectos de la seguridad y
representative
la
to
salud
be
en el
empowered
trabajo
to examine and be
y que
consulted on
sean
all aspects of
consultados
the
al respecto.
occupational
Es decir,
safety and
lo que
health
vamos a hacer
at
es
work.
que a través de este diálogo
Through
social
this
no
social
únicamente
dialogue,
sea consultada la parte
not
empresarial o
only
la parte gubernamental,
the
sino que
governmental
la
or
parte
employer's part
trabajadora también va a
may be
tener un
consulted,
papel
but also
fundamental
the
en el
workers will
desarrollo
have
de esta
a
materia.
fundamental role in the development of
Otro
all these
convenio que
conventions.
tenemos al respecto en
Another
materia de seguridad y
agreement
salud
that
en
is
el
very
trabajo es
important
el convenio
in
número 161,
it's the
Convenio sobre
Occupational
los
Health
servicios de
Services
salud en el
Convention
trabajo.
of
¿A qué nos
1985.
lleva este convenio? Este convenio
This
nos indica la
calls
necesidad de la consulta con
for
las
the need
organizaciones
of
de empleadores y de
consultation
trabajadores
with the most
más
representative
representativas en la
employers
formulación,
and workers
aplicación y reclamen
organization in the
periódico de una
formulation,
política
implementation,
nacional
and
coherente
review
sobre
of a
servicios de
coherent
salud
national
en
policy
el trabajo.
on
Y además
occupational
también la
health
cooperación
services,
y la
the cooperation and
participación del
participation
empleador,
of the
los
employer,
trabajadores y sus
the workers, and the
representantes en la
representatives
aplicación de las
in the
medidas relativas
implementation
a la
of
organización
measures
y demás aspectos
concerning
de los
the
servicios de
organization
salud en
and
el
other
trabajo
aspects of
sobre una base
occupational
equitativa.
health services
Entonces,
uh,
como vemos, no solo hablamos de diálogo
on an
social en la toma de
equitable
decisiones, sino
basis.
también en los servicios de salud en el trabajo, elemento fundamental
So this is a
en
very
la
fundamental
actualidad en la
element
que nos
nowadays
encontramos.
in this context.
Otro convenio,
Another
que
agreement
aunque sea el tercero que mencione, no pierde importancia absoluta, sino
that
una gran
is still
relevancia,
very
es el
important
convenio sobre el
is
marco
the
promocional para
promotional
seguridad y salud en
framework
el
for occupational
trabajo, el
safety and health
convenio, el llamado convenio
convention,
número
so-called
187 de la Organización Internacional de Trabajo.
187
¿Qué nos dice
convention.
este convenio? Este convenio promueve una
This
cultura nacional de
convention promotes a
prevención en materia
national
de
preventive
seguridad y de
safety
salud
and health
basada en
culture
el
based on
diálogo
social
social. Es decir,
dialogue.
ya nos lo está diciendo, debe estar basada esta cultura de
This,
prevención en el
this
diálogo social.
prevention culture
Insta que
must
se
be
celebren
based on social dialogue,
consultas tripartitas
and it
sobre la
calls for a
formulación y
tripartite
aplicación y reclamen
consultation on the
periódico
formulation,
de una política
implementation, and periodic
nacional
review
coherente
of
en
a
materia de
coherent
seguridad y
national
salud en el trabajo y el
occupational safety and
establecimiento,
health
mantenimiento,
policy, the
desarrollo progresivo y
establishment,
reexamen
maintenance,
periódico de un
progressive
sistema
development,
nacional de
and regular
seguridad y
review
salud en el
of a
trabajo,
national
así como la elaboración,
occupational
aplicación,
safety
control
and
y
health
reexamen periódico de un
system,
programa nacional
as well as
de
the
seguridad y
development,
salud en el trabajo.
implementation, monitoring,
Establece que el
and periodic
Sistema
review of a
Nacional de
national
Seguridad y Salud en el Trabajo
occupational safety
incluye
at
disposiciones
work
para
program.
promover a
It
nivel de la
includes
empresa la
provisions to
cooperación
promote
entre la
at all
dirección,
the
los
levels
trabajadores y sus
the
representantes
cooperation
como
between
elemento
management,
esencial de las
workers,
medidas
and
de
the
prevención
representative
relacionadas
as
en
an
el lugar de
essential
trabajo.
element
Como vemos,
of
da
the
un paso más.
workplace-related
O sea,
preventive
nos
measures.
habla ya de
So,
programas nacionales, de sistemas nacionales de
so there
seguridad
are
y salud en el
national
trabajo focalizados
systems
en un
focused
diálogo social.
in a social dialogue.
Hemos hablado hasta ahora
We
de qué
have
es el diálogo social, qué papel tiene la Organización
now
Internacional
talk
del
on
Trabajo en el
the
diálogo
role
social, qué convenios, qué normas
of the social
internacionales nos mencionan y nos regulan este diálogo social. Pero ahora vamos a hablar a nivel nacional, en este caso, a nivel de México. ¿Qué
in
papel
a
tienen los
national
interlocutores
level.
sociales en la construcción de una
The
cultura
role
de
of the social
prevención en
partners
materia
in
de
building a
seguridad y de
preventive
salud?
safety and health culture in
La
Mexico.
participación de los
The
interlocutores
participation
sociales
of
en las
the
ordenanzas de seguridad y de salud
stakeholders
en el trabajo
in
ayudan
the
a la creación de una cultura
occupational
sólida de
safety
prevención
and
en
health
materia de
at
seguridad y
work
salud que requiere la
requires the
participación de las
involvement of
organizaciones de
employers
empleadores y de trabajadores en
and
la
workers'
gobernanza de seguridad
organization
y de salud.
in
Los
the
interlocutores
occupational
sociales
safety
pueden tener
and
intereses
health
y
at
perspectivas
work.
diferentes.
Social
La
partners may have
consulta y el
different
debate
perspectives.
tripartito puede
Tripartite
contribuir a
consultation and
mejorar la
discussion
comunicación y
can
a
contribute
comprender
to
mejor
improve
las
communication
preocupaciones y las
and a better
limitaciones que
understanding
pueden
of the
tener las
concerns
partes,
and constraints that the
así
parties may have,
estableciendo el camino para
establishing
emprender
thus
acciones
the
conjuntas
path
y
to
acordadas
have
para el desarrollo de una
actions
cultura de colaboración en cuyo
together of
marco se
a
pueda
collaborative
abordar los
culture
retos en materia de
in which
seguridad
all
y de
the
salud en el trabajo.
challenges of
Es
occupational
necesaria una
safety and health
coordinación
at work
estrecha
are
entre todas
addressed.
las
Close
partes
coordination
interesadas para
among
definir
all
los propósitos, las
stakeholders is
prioridades, los
necessary to
objetivos y
define
las
common
metas
aims
comunes
priorities, objectives, and goals in order to strengthen the national occupational safety and health system, enabling a more efficient use of all the available resources. What do we need? There must be an open communication because the interests of all the stakeholders are different. And if we don't communicate each other, we are not going to know which are the interests of each part, and we will not arrive to an agreement of the whole of the people involved in the social dialogue.
La adopción de políticas de seguridad y de salud
The
en el
adoption
trabajo a
of
través del diálogo social.
policies of
El convenio
occupational
sobre
safety
seguridad y
and
salud
health,
de los trabajadores
the
de
Occupational
1981, el
Safety
convenio
and Health
número
Convention of
155 y el convenio sobre
1981
el marco promocional
and
para la seguridad
number
y la salud de los trabajadores del
155
año
and the
2006,
Promotional
el convenio
Framework
número
for Occupational
187,
Safety
instan
and
a la adopción
Health
de una
Convention
política
of
nacional coherente en materia de
2006
seguridad
call
y
for
de
the
salud en el
adoption of a
trabajo. Dicha
coherent
política
national
deberá
occupational
construirse a través de la
safety and health
consulta y el debate
policy
tripartito,
that should be built through tripartite consultation and debate, which confers legitimacy and favors its implementation.
Nos va a dar una fortaleza para poder llevar a cabo su implementación.
And this will make us strength to implement this policy. It has to include, as minimum, the government's commitment to the prevention of occupational accidents and diseases, the basic principles guiding national actions on the field of occupational safety and health at work, and the areas of the areas for action on the occupational safety and health. Authorities, employees, and workers and their organizations, recognizing the complementary nature of these responsibilities. How can we apply these conventions in an efficient way? A comprehensive and functional regulatory framework should cover all workers and all branches of economic activity, address all the risks related to occupational safety and health to which all the workers may be exposed. It also includes a single general law on occupational safety health at work, laws and regulations complementing these laws, technical standards and codes of practice, complementing the legislation by providing more specific guidance to employers and works on how to do them, and collective agreements, which is the result of negotiation between employers, workers, and their respective organizations. In formulating the OSH legislation, the integration of social dialogue at various levels is conducive to sustainability, even if the legislation is complex, because we are going to start from the more general up to the most particular parts, having into consideration all the stakeholders, so we can know all the existing needs and what are the measures that we can take in order to reach our goals. At the beginning, we called of the COVID-19 effects and how this social dialogue has been promoted and helped for the management of the pandemic. We have some results here. The pandemic 19 is related with the increase of bipartite and tripartite agreements in order to mitigate the risk of contamination in the workplace. 83% of the union poll has adopted a social dialogue as a response of the pandemic, as well as 83% of the union poll has participated in tripartite consultations. 59% of the 133 polled countries, the tripartite dialogue has place in response of the crisis of the COVID-19 pandemic as a measure in a world poll. The union indicated that the COVID-19 had increased the impact of the occupational safety and health within its collective
saber, los
negotiation
requisitos para la
agenda.
evaluación de riesgos, los acuerdos
All
de
these agreements
las disposiciones sobre las
has
pruebas
centered
sistemáticas
in
y la
these points:
vacunación.
the
Como
requisite
vemos,
to evaluate
puntos
risk
que hay que
evaluation,
resaltar
risk
durante la
assessment, the
pandemia
agreements of
COVID-19,
telework, the
porque
disposition
afortunadamente, con
on
carácter previo, no
systematic
los pudimos seguir,
proofs and
fueron
vaccination.
elementos claves de las
These will be
negociaciones bipartitas y
key
tripartitas
elements
y
of
se llegaron a
the
acuerdos por el diálogo
negotiation,
social, y
and
estos
thanks
acuerdos
social
ayudaron a gestionar de
dialogue,
manera
there has
más
been
positiva o más favorable las crisis que se sufrieron en los diferentes lugares de trabajo
the
derivados de una
crisis
pandemia mundial.
derive from a
Promover el
pandemic,
cumplimiento de la
promote
legislación.
the fulfilling of the
No solo
legislation.
hemos llegado al punto de
We
cómo
have
se
reached
crea
the
la
point
normativa,
not only to
cómo
how
se
these
realizan los
norms are
acuerdos, pero
created,
ahora no
how
nos podemos
the
quedar aquí,
agreements
porque la
are
normativa existe, pero
created,
debemos promover su cumplimiento.
how
Y aquí,
to
en la
promote
promoción
its
del cumplimiento,
fulfillment.
el diálogo social también nos puede
Social
ayudar.
dialogue is
Los
also very important in
interlocutores
this part.
sociales son actores clave en
The
las
social partners
iniciativas, en
are
los planes y
key
en las
stakeholders
actividades para
in
promover y
initiatives, plans, and
supervisar y
activities to
hacer
promote,
cumplir
monitor,
la
and enforce
legislación pertinente en materia de seguridad
relevant
y de salud en el trabajo.
occupational safety and
Cómo,
health at
a
work
través de la
legislation
colaboración y el
by
apoyo a las actividades de la
collaboration
inspección de trabajo
and
y
support
otros
for all
mecanismos
the
para promover el
inspection
cumplimiento de la
activities,
legislación.
other
Pueden
mechanisms
ser
to
servicios de
promote
asesoramiento,
compliance,
repertorios de
for such
recomendaciones
as
prácticas,
advisory
requisitos
services, code of
contractuales,
practice,
actividades
contractual
de
requirements,
sensibilización e incentivos que tienen un mayor impacto
awareness raising
cuando los
activities that
desarrollan
have a greater
conjuntamente
impact
las
when they are
organizaciones, los
developed
empleadores y todas
jointly
las
by the
organizaciones
employees
de los
and the
trabajadores.
workers' organization.
Un órgano tripartito que
A
funcione para
tripartite
garantizar la
organ
consulta y la colaboración.
to guarantee the
El diálogo
consultation and
social en materia
collaboration.
de seguridad y de salud en el trabajo
Social
se lleva a
dialogue
cabo
in
en
occupational
numerosos
safety
países. México es un ejemplo
and
de
health
ellos a través de
is
comisiones
been in
consultivas.
several
En
countries.
México
Mexico
contamos
is
a
an
nivel
example.
nacional con el
At
COCONAS, que es el encargado de dar
national level is the
prioridad a este
COCONAS
diálogo social entre
that
las tres
has
partes existentes y poder
prioritized
llegar a
this
acuerdos
dialogue
que
between the
garanticen la
three
seguridad y la salud en
parts
el trabajo.
that guarantees
En este sentido,
occupational
el
safety
convenio
and health at work.
187
The
insta el establecimiento de un
87, the
órgano de órganos
187
consultivos
convention
tripartitos de
call for
ámbito
the
nacional para
establishment of a
tratar las
national
cuestiones
tripartite
relativas a
advisory
la
body or
seguridad y la
bodies
salud en el
to deal
trabajo.
with
Estos órganos
occupational
tripartitos
safety and health at
pueden
work.
ser denominados
These
consejos,
tripartite
comités,
bodies
se han establecido en muchos
have been
países y
established
lo que
in many
hacen es que
countries,
proporcionan un
and they
foro que los
provide a
representantes del
forum for
gobierno, ya sea el
representatives of
Ministerio de Trabajo
governments,
o otros ministerios o
whether
instituciones
the
públicas
Ministry of
que
Labor
tengan interés en los temas en que se estén
or other
tratando,
public
así
ministers
como los empleadores
interested
y
in
los
these topics,
trabajadores,
as well as
debatan
workers and
regularmente sobre la
employers,
seguridad y la salud en el trabajo, garantizando la
discuss
consulta sobre cuestiones relevantes y un
occupational safety and health, ensuring
periódico de las
consultation
políticas y
on
programas de
relevant
la seguridad y
issues
la
and a
salud.
periodic
La
review of
composición tripartita puede ampliarse
occupational
para
safety
incluir a
and health
representantes de
policies
otras
and programs.
instituciones.
The
Es decir, la
tripartite
figura de la
composition may be
comisión
expanded
consultiva
to
o
include
consejo
representatives
consultivo o
of
comité,
other
no tenemos que
institutions.
pensar que es una
We
figura
don't have to
única.
think that
El
it's
convenio 187 lo regula,
an
pero
only
existe
figure.
apertura para que no
It is
siempre
open.
tengan que asistir las mismas personas, sino que dependiendo de la materia
So
que se esté
depending
tratando,
on
pues
the
habrá
issue that
ministerios
they are
o
dealing with,
secretarías
there
que
will be
tengan un interés
ministers
más
that
centrado
will
y
have
que
a more
acudan en un
center
caso y en otros
interest
reuniones no. Pero lo
that
importante es que
accompany
esas
the
reuniones
dialogue
se
in some
mantengan y
other
esas reuniones se
reunions and in
mantengan
others
de
no.
manera
But the
periódica
important
para
is
que
that
pueda haber
these
un
reunions
reexamen de
have
lo que se haya
been taken
adoptado con
place
carácter previo para
regularly.
ver si está funcionando o
So
no está
all the
funcionando.
agreements may
Aquí
be
se comenta
evaluated.
un ejemplo de Brasil,
For
pero
example, in
también
Brazil
podemos comentar el ejemplo de México, ya que
or
como
in
estamos en
Mexico,
México, creo que hace bastante referencia al caso y el número de integrantes en México es
the
de
number of
6 miembros
participants
por
is
cada
6
una de las
members
partes, 6
for
miembros por
each
parte
part,
del gobierno, 6 miembros por la
6
parte
members
empleadora
for the
y 6
governments,
miembros por la
for
parte
the
trabajadora. Pero
workers,
eso no
and
quiere
for the
decir que este
employees.
esquema de
But that
integrantes
doesn't
se
mean
siga
that
en
this
todos los
scheme
países. En otros
is
países
the same at all
están integrados
countries.
por otros números diferentes. Lo que
Each
quiero
country
decir
has
es que
its
se
own
puede adaptar a la
representatives,
realidad de cada uno de los países,
and
pero que lo
this can be
importante es
adapted
que
to the reality of
contemos
each
con estos
country.
órganos de consulta.
But the important thing is that we have these
Las funciones de estos
consultation
órganos también
organs.
varían considerablemente.
The tasks of these
un
organs
país a otro y
vary from
desempeñan
one
desde un
country
papel
of another,
consultivo hasta un papel
and
decisorio en
they
la definición de
can
políticas, prioridades y
they can
planes de
have a
acciones
consultative
nacionales,
role,
así como la formulación de leyes y de reglamentos.
definition, a
Los diferentes
policy
países
definition,
establecen cuáles son
priorities
las
and plans
funciones de sus
of national
consejos
actions, as
consultivos.
well as
Ellos
on
lo
the formulation
determinan
of laws and
y pueden
regulations.
ser, como se comentaba aquí ahora mismo, decisivos en la formulación
And they may be
de
decisive
leyes,
on
incluso para
the
llegar a los
formulation
acuerdos
of
dentro de
laws,
los comités,
even
los
to arrive
consejos
to
o las
agreements.
comisiones.
All the
Existen
commissions,
diferentes foros de
within
llegar a
all the
acuerdos. Hay
commissions,
países,
there
como
are
en este caso
forums.
voy a nombrar Uruguay, donde la
Uruguay,
forma
for
de llegar a un
example,
acuerdo es a través
the
del
way
consenso.
of
Y
arriving to an
mientras que no se
agreement is
consiga
in
consenso,
consensus.
en esa comisión no hay
And
acuerdo.
if the
Ustedes se pueden
commission
imaginar
does
el
not
trabajo
arrive
que
to a
supone esto,
consensus, there
pero
is no
acaban
regulation.
llegando a consensos. Hay otras fórmulas,
There are
mayorías
some
simples,
other
mayorías
formulas,
absolutas, depende de cada país. Pero lo importante,
absolute
vuelvo a
majorities,
decir, es que se
etc.
dialogue y que se
The
puedan
important
adoptar
is that
medidas
the
muy
dialogue is
relevantes
still
en materia
going
de
on
seguridad y de
and to
salud en
take
el trabajo.
important measures
Las
regarding
comisiones,
occupational
consejos o
safety and health
comités
at work.
no solo
All
realizan
the
este tipo de funciones, también hay otras actividades
commissions,
relevantes de los interlocutores sociales
there are
en
some
el ámbito
other
de seguridad y la
relevant
salud en el
activities
trabajo,
on
como puede
the
ser una orientación y
stakeholders on
asistencia
social
técnica.
dialogue.
En este
That could be
sentido, por
an
ejemplo, la
orientation
Organización
and technical
Internacional del Trabajo
assistance.
estamos
For example, the
invitados
ILO,
en
we are
numerosas
invited
ocasiones a este
in
tipo
several
de comités
occasions to these
o de consejos
committees
para poder
or
dar nuestra asistencia técnica si existe algún tipo
to
de
give
duda
our
respecto
technical
a la
assistance
reglamentación de una
regarding
materia que no había una
regulations.
reglamentación previa, por ejemplo, en ese país. O pueden ser campañas de
It could also
sensibilización
be
para
sensibilization
difundir
campaigns
información
to
esencial y familiarizar a las
inform
personas
and
empleadoras, a las
familiarize
personas
employers,
trabajadoras.
workers, and
También pueden
communities,
realizar
their
investigaciones en
duties and
materia de seguridad y
responsibilities.
de salud en el
There can be
trabajo, así
also
como la
research
recopilación de
in
datos e
occupational
información
and
sobre
safety and
seguridad
health,
y salud en el
as well
trabajo.
as to gather data and
Estos
information on
órganos de
occupational
consulta
safety and
son
health. These
fundamentales
consultation
si queremos
organs
garantizar
are fundamental
un
if we
trabajo
want to
decente
guarantee a
desde el
decent
punto de vista de
work
la seguridad y
from the
la salud en el
standpoint of
trabajo,
view
porque
of
es
the
acá,
occupational
en estos
safety and
órganos,
health at
donde
work,
vamos a ver
because it's
qué
within
problemas
these
está habiendo, cómo podemos
organs
resolverlos,
that
qué
we can
cosas han
see
hecho
what
bien,
problems
qué
are
cosas
arising
podremos seguir aplicando.
and how are we going to apply all these
Ya por último vamos
regulations.
a hablar del nivel del lugar de trabajo. Como habéis
We
visto,
are
hemos
talking
pasado a
at the
nivel
workplace
nacional,
level.
nivel general,
So
nivel internacional, nivel nacional,
we
y
went
ahora
from
vamos
the
a ver
international
el
level
nivel
to
del lugar
national
de
level,
trabajo,
and
la
then we are going
cooperación
to the
entre los
workplace level.
empleadores y
The
los
cooperation
trabajadores
between
para una
employers and
gestión
workers
eficaz de
for an
seguridad y de salud
effective
en el trabajo. No lo podemos olvidar este
occupational
punto,
safety and health
cooperación
management. We
entre
cannot
ambas
forget
partes, cooperación
cooperation,
bipartita. Estamos pasando ya al lugar de trabajo, ya dejamos a un lado la consulta tripartita
bipartite
y nos centramos en la bipartita,
cooperation
también
between
denominado comité
employers
mixto, dependiendo del país
and workers.
del que estemos tratando. El papel de los empleadores y los trabajadores,
The
derechos
role
y
of employers and
responsabilidades
workers,
básicas en
rights and
materia de seguridad y de
responsibilities,
salud en el
basic
trabajo. Aquí no
rights
podemos
and
olvidar algo que es
responsibilities.
fundamental.
We cannot forget something
Las dos
fundamental.
partes,
Both
empleadores y
parties,
trabajadores,
employers
tienen
and
obligaciones
workers,
que cumplir
they have
y
responsibilities to
tienen derechos,
fulfill
pero
and also
también
have
tienen
rights.
obligaciones. Ambas partes
Both
deben
parties
cumplir con la normativa
must
establecida en materia de
fulfill
seguridad y de salud en el trabajo.
the
Por parte de los
regulations.
empleadores,
From
deben
the
garantizar que los lugares de
responsibilities of
trabajo,
the
la
employers,
maquinaria, el
they
equipo de
must
operaciones y
guarantee
los
that
procesos
the
sean seguros
workplaces
y no
may be
entrañen
safe
ningún tipo de riesgo
and
para
don't
la
have any
seguridad y la
risk
salud de las personas
for
trabajadoras.
occupational safety and
Además,
health for
también deben
workers. They
garantizar,
have
en la
to
medida en
guarantee
que
as
sea
well
razonable y factible, que los agentes y
that
las
the
sustancias
agents and
químicas, físicas y
chemical,
biológicas no
physical,
entrañen riesgo
biological
y que puedan
substance
otorgar las protecciones
does
adecuadas a
not
las
mean
personas
risk for
trabajadoras.
the
Además,
workers.
deben suministrar
They have to
los equipos de
administrate the
protección personal.
personal
Deben
protection
prever
equipment.
las emergencias y
They
los
have
accidentes que puedan darse
to
y también deben garantizar que las
to
personas
guarantee
trabajadoras y
that the
sus
workers and
representantes
its
sean
representatives
consultados,
may be
informados y
consulted,
reciban la
informed,
formación
and they
en
receive
materia de seguridad y de salud en el trabajo.
training on
Pero ahora
occupational
pasamos a la
safety
parte de los
and
trabajadores.
health at
¿Qué
work.
deberes y qué derechos
The rights
tienen
and
ellos en
works,
materia de seguridad y
the
salud?
rights and
Tienen
responsibilities of the
derecho a
workers. They
interrumpir una
have the right
situación de
to
trabajo
interrupt a work
por
situation
motivos
by belief,
razonables y que estén
for
justificados
a reasonable
que
motive,
entrañan
that
un peligro
it is an
inminente y
imminent
grave
risk
para su
and
vida o su salud
for its
en
health or life
consecuencias injustificadas,
in
es
unjustified
decir, la
consequences.
paralización de la actividad en caso de que determinen que hay un riesgo grave
So to
e
stop the
inminente.
activity.
Derecho a recibir la información
right to receive the adequate information and appropriate training, right to inform and to be consulted on all the aspects related to the occupational and safety and health at their workplace. They have the obligation to cooperate with the workers in the occupational safety and health at work, like fulfill the instructions and procedures, use correctly all the personal protection equipment, inform any risk situation while working. In order to guarantee the cooperation between workers and employees in occupational safety and health at work, the participative agreements are related to a better practice of management in the occupational safety and health at work, better results, and a decrease of the accidents at work and professional diseases. Cooperation between workers and employers. Whether there is a decrease of risks by an open communication between employers and workers as an explanation, because there are sometimes that employers, because they don't do the daily activity, does not know the risks, the risks that the worker does know because they are working daily with those risks. So if they have an open dialogue between the employers and the workers, this will make that the company will take some prevention measurements and to prevent accidents, which is actually our aim through all this process of establishing a social dialogue. As well as 64% less of accidents, as well as 58% less of hospitalizations, and the workplace to promote that the workers commit to a positive culture on occupational safety and health. More than 2 million workers around the world feel that they cannot notify of all the problems without the risk, without fear of retaliation. Throughout all this, we are
superiores, decimos que está ocurriendo, los superiores hablan con las personas trabajadoras. Pensamos que a lo mejor no es algo tan difícil de abordar, pero sí es algo difícil de abordar.
We may think that that it's not that difficult to make a dialogue, but it is actually a problem because they fear of any retaliation. That is why it's so important to promote a social dialogue, an open communication. That is why it's so important to be more flexible in authoritarian without any negative consequences. Simply there are circumstances that are given and circumstances that we must treat to guarantee a safety organization. In order to promote occupational safety and health at work, are a logical and useful tool to promote continuous improvement to performance within the organization. They include a set of actions and processes that establish, monitor, and evaluate the organization's efforts in order to keep the workers safe and healthy. The element keys for successful implementations are the integration of the occupational safety and health at work management systems into the overall management of the company, as well as ensuring both the commitment of the management and the active involvement of workers in its joint implementation. Nowadays, all the companies must have implement and promote, based on social dialogue, the occupational safety and health at work in order to decrease all the risk, accident, and occupational diseases at workplace.
hacemos o cómo deben los trabajadores
how does the
participar
workers
en un proceso de
participate
evaluación de
in an
riesgos.
evaluative risk
Como parte de la gestión de la seguridad y la
process.
protección de trabajo, esta gestión que debemos
This
incorporar dentro
risk
de la gestión general de las
assessment
empresas, los
that we must
empleadores deberían
incorporate,
realizar periódicamente una
employees
evaluación de riesgos que incluya
should
la
periodically
identificación de los
carry out
peligros,
a risk
la
assessment,
evaluación de los
including
riesgos
the
asociados y la adopción de
identifications of
medidas
those
razonables
risks,
y
the
proporcionadas para
assessment
controlar
of
dicho
the
riesgo.
associated risk,
Una
the
evaluación de los
adoptions
riesgos
of
bien hecha,
measures
¿en
to
qué nos
control those
ayuda? Pues
risks,
contribuye a
and
la
this
protección de la
contribute
salud y el
to the
bienestar de los
protection of
trabajadores y
workers'
beneficia
health
a las empresas a través de una
and well-being,
mejor
benefit
organización
also
de las
the
prácticas de
companies
trabajo,
through
con un
better
posible
organization of
aumento de
work
la
practices,
productividad.
with a
Esto
possible
es un punto que no
increase
se
in
puede olvidar.
productivity.
Las
In
empresas
productivity.
que
This is very
tienen
important.
índice de accidentes de trabajo,
Companies that has
índices de accidentes de trabajo y enfermedades profesionales en su conjunto, índice de
occupational
siniestralidad menores, son las
diseases
empresas más productivas.
and
Estamos
occupational
en un
accidents
evento con
that have
el
the
Centro
less of this,
Interamericano de Estudios de Seguridad
they are more
Social y la
productive.
Conferencia Interamericana de Seguridad Social. Ellos más que nada son quienes nos pueden decir cómo afecta la
Here
siniestralidad
at the Inter-American
a la
Conference on
seguridad
Social
social,
Security
porque
and
a
the
través de los
Inter-American
pagos,
Center for
a
Social
través de los
Security Studies
costos,
can
muchos
tell us
elementos que incluso en
how
determinadas empresas un
how
accidente ha
is it
llevado al cierre
important
de la propia
accidents
empresa,
and
debido
occupational
a los
health
costos derivados de poder atender esa circunstancia. Entonces, aquellas empresas que tengan
those companies
índices de siniestralidad
that have
nulos o mínimos
less
en
or
donde está
minimal
controlado, la
accident
productividad está demostrada que es mucho
productivity
más elevada.
is much more elevated.
Los empleadores deben asegurarse
Employers
de que los
should ensure
trabajadores
that the
y o sus
workers
representantes
and their
participen
representatives are fully
plenamente en el proceso de evaluación de riesgos,
involved
ya
in the
que
risk
disponen de la
assessment
información
process
útil sobre cómo se
because they
realiza el
have
trabajo,
useful
lo que
information on how the work
constituye
is
que la
carried out,
evaluación de riesgos sea más rigurosa y
which
eficaz.
contributes
Aquí
to a
añado lo que
more
comentaba
effective
antes.
risk assessment.
Nosotros a
And
veces, incluso los
sometimes
prevencionistas, estando en los comités de
preventionists
seguridad y de salud,
being
hay
in these
determinados puestos de trabajo en los que no los
committees
desempeñamos y no estamos ahí en el día a día. Entonces, esa
that we
comunicación
don't
abierta
know
de una
what
persona
is going on
trabajadora
the day
que
on
se
a daily
sienta libre de
basis.
poder comunicarnos un
So
riesgo
if a
existente va
worker
a
feels
ayudar
free
de
to
manera
communicate
general
all
a
the
la
risks,
mejora de todo
is
el
going to
sistema.
help to improve
Ya
the
por último
improvement of
finalizo,
all
les doy
the
las gracias
company.
a todos por
Thank
este
you very
tiempo de
much.
atención. Espero les haya sido
I
útil.
hope
La idea que
this
hemos
may
tenido
be
ha sido
useful.
hablar de los conceptos de diálogo social, cómo
The
podemos llevarlo a
idea
nivel
that we
nacional
have
y ya
is
cómo
to talk on
podemos
the
llevarlo a los
concept of
centros de
social
trabajo
dialogue
y
and
qué
how can we
finalidad tiene este
take
diálogo
them into
social.
the workplace
Muchísimas
and what
gracias.
is the aim of this social dialogue.
Muchísimas gracias a la maestra
Thank you
Paula
very
Álvarez
much,
por la
Paula
ponencia.
Álvarez.
Le
Maestra
agradecemos mucho
Paula
su
Álvarez.
tiempo. Y
Thank a lot your
queda
time.
claro que el diálogo social es un
It is
eje
clear
central
that social dialogue is
para
a
establecer
fundamental
estrategias de
axis to
prevención y
establish
promoción de la salud.
promotion
Y
strategies
cabe
on
mencionar
health,
que
on
el
occupational health,
retorno de la
the
inversión
investment return
de programas
of
encaminados
programs
proteger
focused
la
to
salud de los
protect
trabajadores y promover la
workers'
salud de los
health and
trabajadores.
promote workers' health.
Los estudios nos demuestran
The
que
studies
efectivamente en el
demonstrate
peor
that
de los casos hay un
indeed in the
retorno
workplace
de la inversión neta,
there is a return of
pero la gran mayoría
investment,
de
but
los
in the
estudios
majority
concuerdan
of
que
the studies
hay
agree
un ahorro importante.
that there is an important
Así
save.
que hacemos la invitación
So we invite
a nuestras instituciones
to all
presentes
our
que seamos
present
ejemplo
institutions
de esas
so we
condiciones de
can be
trabajo
example of these work
que
conditions
promueven
that
el
promote
trabajo decente
decent
y que
work
desde
and
nuestras instituciones emane el ejemplo
from within
y
these
esta cultura de
institutions
promoción
the example and this
de la salud.
promotion health culture may be promoted.
Pasaremos a la siguiente ponencia
We will
a
be
cargo de la
to the
doctora
next
Patricia Redondo Escalante.
with the next
Leeré
panelist,
un poco
doctora Patricia
leeré,
Redondo
la
Escalante.
semblanza curricular.
I'm going to read
La doctora Patricia
summary.
Redondo Escalante
Doctora
cuenta con una
Patricia Redondo
licenciatura en
Escalante holds a
medicina
degree in
y
medicine
cirugía
and surgery
por la Universidad de
from the
Costa Rica.
University of Costa
Ella
Rica.
es médico
She's a
especialista en
medical
medicina del
specialist
trabajo,
in occupational medicine.
máster en seguridad
She
y salud
has a
del
master's
trabajo
in occupational
por la
safety and
Universidad
health by
Autónoma de
the
Madrid. Impartió la
Autonomous University
docencia
of Madrid,
universitaria por
Spain.
20 años
She
en la
has been
Universidad de
teaching
Costa
for
Rica
20 years at the University
y
of Costa Rica, and
actualmente
she's
labora
currently
como jefe
working
del área
as head
de salud
of
ocupacional de
the
la Caja
occupational
Costarricense de Seguro
health
Social.
area of the
Ella es
Costa Rican
vicepresidenta del
Social
Consejo de
Security
Salud
Fund.
Ocupacional de Costa Rica
She's vice
y
president
también
of the
tenemos la dicha
Occupational
de
Health
contar con
Council
ella
of Costa
como
Rica, and
secretaria
we are
técnica de la
fortunate
Comisión
to
Americana de
have
Prevención
her
de
as
Riesgos en el
technical
Trabajo.
secretary of the American
Doctora, le
Commission
cedo la
for the
palabra.
Prevention of Occupational Risks in Work. Good day to everyone. to all participants and the panelists. I'm going to share my presentation. Are you watching them? Watching it?
El problema técnico, ¿verdad? Para mí es un placer
For me,
estar
it's a pleasure to be
que me hayan tomado para
here
participar en este webinar.
participating in this webinar.
Como Javier lo indicaba, aquí
And as
tengo
Dr. Javier
esta
said,
presentación, pues un triple rol,
we
¿verdad?
have
De la Comisión Americana de Prevención de Riesgos del
a
Trabajo,
triple role from the Occupational Safety and Health Council, from the Costa Rican Social Security Fund, which I am going to present an experience that the occupational safe, the Occupational Health Council. First of all, I want to present my country. It's a very small country. We have a population of 5,090,000 people, occupation workers, 2,106,072 people, and an unemployment rate of 13.1. It is a country that has been worried on the workers' health. So I'm going to share this experience. How have we been doing this occupational health from the Occupational Health Council that this year is having his 40 anniversary, that it was created in 1982. That it is fundamented on the creation of the law on the Occupational Health Council. The structure of this Occupational Health Council, we have two levels. The technical and direction decision called Directive Council that has a tripartite body, government representatives, workers representatives, and employers representatives. As a representative of the government's representative, we have the Minister of Labor. We have also health ministry representatives. We have also representatives of the National Institute of Insurance, that is a governmental body that in Costa Rica has its monopoly of work risks, and a representative of the Costa Rican Social Security Fund, that is who is interested in the health of the population in general. We have representative of the agriculture minister and of the industrial chamber. We have also representative of workers that are generally will be of union federations. This council, this directive council, also participate the executive director of the technical secretary that works as a secretary. He has voice but not vote. And in this operative level, we have a technical secretary formed by approximately 15 people, and its responsibility is the design and execution of technical actions, review the national politics and institutional politics. At the same time, this council, what does it do? Well, promote better work conditions. Nationally, it makes all the regulation on occupational health in workplace, and also prepare law projects and regulations, and also inform, train, and all the prevention at the workplace. The main fulfillments of this council in these 40 years, and that they are product of all the activities of social dialogue, where there exists a consensus, an agreement. At least I have participated in this council the last 20 years, and I can assure you that one or two times we have had several discrepancies in these three parts, and all the projects and all the things that we dialogue in this council is made by consensus. The main achievements is the technical legal framework for occupational safety and health elaboration, the consolidation and strengthening of institutional and company structures, as such as occupational health commissions, as we call it as in our country, and the occupational offices, which is a fundamental instrument for implementing occupational risk prevention and the promotion of health and well-being at the workplace. We have also the generation of a preventive and promotion culture of safety and health at work. And in the past years, in the past 10 years, we have deepened in the research, which is a fundamental role to define priorities and reorientate projects, as well as to organize campaigns of information and divulgation. As well, we have, and it is very important for the decision making, the annual report of accidents at work, occupational accidents. I wanted to present you a little bit some of the projects that we have developed within this Occupational Health Council. We have this educative strategies to prevent, to propitiate prevention attitudes in a pre-scholar level. We thought that in the childhood, it is very important to introduce the concept of safety, health, and work at work, where we have in the Children Museum we have some policies as safe neighborhood, safe school, so the children can be learning the importance of prevention and the safetyness in their future as workers. Also, in the midst of the pandemic, we make the COVID seal, that is, they promote the workplaces, the safety workplaces to promote the workers' health. What we do is that companies and institutions have to fulfill a minimal requisite in order to have this seal, this COVID seal, to guarantee the health of workers, and also that the healthy measures are taken to prevent this illness in the workplace. In these years of pandemic, we had a divulgation campaign called Balancear la Vida and Work. Balancing life and work is an art. Focus on telework, and where there was a lot of of emphasis was made on mental health and work, as well as the implementation of active pauses during telework, as well as the great challenges that we have assumed from within this council is a work centers portal, where our aim was to have in each workplace each health occupational health commission would have a tool to identify all the activities that has done, and also for the occupational health council could systematize all this information to help us in the decision making, to prevent occupational risks at workplace. I would like to show you a lot of more of the things we have achieved from the Occupational Health Council, in which social dialogue have been the main issue. I leave you here our social media, where you can go and through Facebook, Instagram, our webpage, or through our YouTube channel, where you could find all the campaigns and all the tools that we have developed. We have some webinars as well. So you can see all the topics that we have been discussing and all the activities we have been implementing in all the country. We are going to go with the experience of the Costa Rican Social Security Fund, that is member also of the Occupational Health Council, and as well as the institution that keeps the health on the workers. This institution has nowadays 62,000 workers, in which 55.1% are women with an average age of 35 years and with an antiquity of 12 years. This population is classified in 4 occupational groups, in 26 occupational subgroups, and in 587 different job profiles. From this, you can see the amount of occupational risk that we could have. We are distributed in 300 work units nationally, and where 87.5% of this worker population are in the units of health services, and the 11.5% are in the production unit. We have a high percentage. Our incomes, we made it ourselves. We produce medicines. We have a lab. We produce textile. We produce all our input. So we have an industrial part, which have a very important health risk, different at the production units. We also have a financial administrative part that works at the central level. In the environment that we are working, we go from the bipartite to the tripartite scheme, in which in our institution we have six managers, and in the occupational health is part of the administrative management. through the direction of work well-being. And this is the only unit of all the institution that is thought for the workers. It's the only institution that works for the internal user, that's the workers. And that is where the occupational health area is. So we have the responsibility of the workers' health. At the same time, we have a regulative framework that comes from our political institution, the WHO and ILO agreements. We have ratified the 180. We have not ratified the agreement 187 agreement from the ILO, but we do take them as a recommendation. We also have our work code. In the fourth title in the law 6727 is the law regarding work risks. We have all the decrees and regulations that have been established since the occupational health minister, that are approximately 48. And in the institution, we have the institutional regulation and which was made as a collective agreement in 2010. It was for the first time it was introduced a specific part on health at work. We have occupational health at work policy and a policy of management of people, where we have two exclusive framework for the security and health of worker people. How can we approach or tackle the management of safety and security at work at the Costa Rican Security Fund? We have the occupational health area that is responsible to propitiate a healthy and productive work environment, with actions related with the surveillance of health of the workers, the different techniques for management and control of risk factor at the work, as well as to surveil the application of the regulations at the workplace. In this way, we have a management of social security at work from a central management, but as well we have a regional and a local management. How do we do it? We do it through the preventive structure on occupational health, in which, where I was telling you, we have the area of occupational health. Those numbers correspond to the number that are working in that area, and that in this moment we are 6 people. It is a multidisciplinary area. We have doctors, we have specialists in occupational work, in occupational health. We have social workers and psychologists. We also have this regional supervisors. It is divided in 7 regions. So we have in each region a professional on occupational health, and it is the one who is responsible of conducting and supervising all the units that has in charge on occupational health at work. And at the same time, at the local level, we have occupational health offices that we would like to have in all 3,100 work centers. Nowadays, we only have 27 offices, from which they are in some health areas, in some administrative areas, and in hospitals. In all the biggest hospitals of the country, we have 29 hospitals, but at least in the main hospital, we have professionals on occupational health. We have the commissions on occupational health. In this moment, we are in the election process. They are elected each 3 years, and we believe that we are going to increase the number. Nowadays, we are working with 188 commissions, and we hope to have more, especially at the administrative levels, where we have less participation. And we also have what we call the services of health at work. We call them physician that is in attention to the worker. In some other places, they are called company medicines. We have nowadays 132 days. Not all the doctors are occupational doctors, but they have been trained from the occupational health area. So they understand this relationship between health and work, and they are able to understand the risk that the workers are exposed in its workplaces and how to prevent them and how to help them if they have any health issue. And we also have what I'm going to explain, that is a system on occupational health that we have been 5-6 years that we've been planning. And in October of last year, we would like to start the first model of this information system. So, which is going to be the technical support that we have in the Costa Rican Fund to manage the occupational risks, as I was saying, in an integral or holistic way. We tackle the psychosociology through psychology, through occupational nurses, and social workers. We have security and hygiene, and we also have occupational medicine. All three, they work integrally. We, since the occupational health area, make some annual evaluation of what they are doing, and they are evaluated as an integral part of the workplace, for which we have elaborated a manual to make a standard rule so that all our units apply the health and security at the work under the same framework and regulations. This manual has a focus on management and prevention, which this manual has several components. The first one is going to be the compromise of the authority of the work center, of the workplace. If they are not, if they do not agree with the importance of health at work, we are not going to reach our goal. So we have this has been the most important work with the managers and with the authorities, thus the sensibility and to have the compromise of the authorities. We also have in this manual which are the functions of preventive structure and how they must develop it. We also have a part of occupational risk management. How can they be identified? which are the tools that has been developed from the occupational health area. We also have a part of register, research, and follow-up of accidents and occupational diseases. We also have another part on how to make a project and services of improvement of infrastructure and equipment from a standpoint of view of occupational health. We make all this help in a national, regional, and local level through the occupational health perspective. We also have another part of promotion of occupational health and prevention of illness at the workplace through the occupational doctors under the surveillance of workers' health. We also have a guide on how this sensibilization and training must be done to workers and employees. We also have, and this perhaps may be the most important thing, all the process of evaluation of security and health at work. We make it once a year, and we make a new evaluation of health management as a whole, whether they are fulfilling and following all the rules in each of the work centers. And what does the professional non-occupational health is doing, and how is activating the health surveillance of workers. By the last time we conclude with a component of a continuous improvement after making this evaluation and identifying risks. So what are we going to do? And this, we do it after the results of the evaluation process in order to develop some improvements and to decrease the risks on a workplace. This is, as I was telling you, this has been our last work, even in this manual that is updated and focused on the use of our institutional system on occupational health, which it's a system with technological tools to manage preventive work risks and the surveillance of the health of workers as the principal pillar columns of the health work. We have a special emphasis on the improvement of work conditions, on the report of accidents or work diseases, to the research of incidents. This system was taught from an administrative, from the integration of an administrative part and a clinic part, in which the main interest is the work job. We have 5 different models. The first one, the register of accidents and work diseases, the risk management, report of external violence, based in the 190 agreement against harassment, in which we are going to be the first institution of the country that is going to have informatized system on harassment, and the part of surveillance of occupational health that is related with EDUS, with our system of health services. In this experience, we use the social dialogue, where we had to make a lot of negotiations with different institutions, because this system has take information of at least 10 different systems that the institution has, and that has been consolidated in order to have the information of our workers, and in order to help us for the decision making. To conclude, I show you which is the face of this system. How does it look? The system to identifying risks, and we make the different valutations, whether the risks are high or low. We can also see by work unit, by all the institution, or we have the prioritization of risks, for example, at a local or regional level, or at a national level. We also have how are we going to make the report of external violence. Then this has been our work from the institution, from our experience, from the efforts that we have made to fulfilling all the mandates for prevention of occupational risk, to minimize them, to control them, and to have healthy workers, and to have healthy results. Well, with this is everything. I finished with this. Thank you very much. I hope this has been interesting for you, the experience that we have from a very small country such as Costa Rica, but which has committed with workers' health. Thank you very much.
Doctora,
Thank
agradecemos
you very
mucho
much,
su
doctor.
ponencia.
Thank you very much.
Además,
Your
recordamos a
presentation.
nuestro auditorio
We also
que el día de mañana, a
remind
propósito
our
de la presentación de la doctora Patricia
listeners
Redondo,
that
tendremos
we will
experiencias de otros 3 países.
experiences of all other 3
Los esperamos
countries.
mañana a las 12 del día, igualmente, horario de México, para
Hope you can
escuchar
join
este
us at
panel
12
con experiencias de
p.m.
Estados Unidos,
with experiences from the
Colombia
USA,
y
Colombia,
Argentina.
and Argentina.
Leemos en el chat algunas inquietudes. Estaremos pasando una muy breve sesión de preguntas y respuestas, ya que estamos sobre tiempo. Las preguntas técnicas que tienen sobre las ponencias y sobre la información, ya mis compañeros han estado contestando en el micrositio de la CAPRT. Ahí vamos a montar la grabación de las ponencias del día de hoy, junto con los materiales.
We're going to upload all the materials and all the presentations.
En la sesión de preguntas y respuestas tenemos particularmente 2 preguntas.
We have 2
la primera es,
questions.
me voy a permitir leerlas, perdón. Dado que el empleo informal es mayoritario, al menos en México,
taking into consideration that informal
y la salud
work in Mexico is really big,
informales, ¿tiene la OIT
who has the responsibility to take the health of these informal workers?
En el caso de los trabajadores informales.
Among who would be the tripartite dialogue in this context of informal job?
Dice, ¿qué importancia tiene el diálogo
the second question is, what is the importance of tripartite dialogue in the promotion and of
en una
dialogue
sociedad en la que predominan las relaciones atípicas laborales? Y por relaciones atípicas laborales asumo que se refiere igualmente al trabajo informal.
So I think that is informal job conditions.
Bueno, en primer lugar, muchísimas gracias por las preguntas realizadas.
For the questions.
Y sí, nos encontramos en un país donde la tasa de informalidad es elevada, pero justamente este tipo de órganos, de diálogo, de consulta puede ayudarnos también a impulsar a que no exista esa informalidad. Cuando está comentando, en el caso, voy a hablar especialmente de los comités paritarios, los que se llevan a cabo en lugares de trabajo, entre empleadores y trabajadores. Puede ser entre empleadores y trabajadores con los representantes de los trabajadores. ¿Qué quiero decir con todo esto? Que en caso de que en un lugar de trabajo, en un centro de trabajo, haya determinadas personas que se encuentren en la informalidad, sería
there may
bueno,
be
la
people
recomendación
at
sería que acudiesen a
informality.
sus representantes de
Would be good
trabajadores para que
if
estos
they
temas
go to
puedan tenerse
the
en cuenta y estos
representatives,
representantes también sepan guiarles un poco
so this
en qué
representative may
medidas
guide them
adoptar para poder llevar a
in all
cabo
the measures
esta
that they
garantía
have,
que hemos
they
hablado
could
desde un
take
primer momento de un trabajo decente, el cual conlleva
in
también la
order to
formalidad
have a
de las
decent
personas
work.
trabajadoras en los lugares de trabajo. Con respecto a si existe
Regarding whether there's
exists
a regulation
claro, es
on
uno de
social
nuestros
security and
pilares
informal job,
fundamentales
of
el
course,
poder
it's our
determinar que
one
las
of the
personas
most
trabajadoras se encuentren
important
afiliadas y
issues.
cuenten con un sistema
That
justo
is
de
that the
protección
workers
social.
have a
Entonces,
just
en ese sentido, ¿cómo
social
podemos
security
utilizar
system.
los órganos
How can we
consultivos de
use these
seguridad social en el
consultative
trabajo para personas
or
que se
bodies
encuentran en
for
formalidad?
people that are on the
Respaldándose y
informal
apoyándose en los
sector?
representantes de los trabajadores en este sentido, que para que esas
Having the support of the workers' representatives, because they can work in the name of all the
Muchísimas
workers.
gracias, maestra. Realmente es
Thank you very
un
much,
tema muy
maestra.
complejo el de la informalidad.
It's really a
En nuestros
very
países,
complex work in
principalmente en
our
América Latina,
country,
donde
especially in Latin
representan
America,
un
where it
porcentaje
represents a
importante
very
de
high
la fuerza
percentage
laboral.
of workforce.
Y efectivamente hay otros
And
grupos
indeed,
ocupacionales
there are some other occupational
que
groups
posiblemente no
that
tengan una
possibly
representación, pero
does not
que
have a
podría existir un
representation,
tipo de
but
figura de
may
gremio,
have
¿no? de
a kind
trabajadores
of
informales. Sí,
informal
doctora,
representative.
la escuchamos, doctora Corrales.
Gracias.
Thank you.
Quería
We listen to you,
complementar
Doctora Corrales. I wanted to
un
complement
poco la temática
the
sobre
theme
la
on
participación. Si
participation.
bien hemos estado viendo en la mañana de hoy toda la
Have
estructura que con mucho
been
esfuerzo
seeing
se
all
ha
the
venido
structure that
estableciendo a
with a
través
lot
de
of
la
efforts have
Organización
been
Internacional del
established
Trabajo
through the
y de
ILO
las instituciones de
and all
seguridad
the
social.
social security
Cuando se habla del
institutions.
tema de
When we
informalidad,
talk
como
on
estamos
informality,
comentando aquí,
as we are
vamos un poco más
telling,
allá,
let's
porque
go
tiene que
beyond,
ver con
because
factores
it also
culturales y
is also
factores
related with
sociales
cultural and social
que se
factors
suman a este
that are
proceso y a este
some with
esfuerzo.
this process and
En
this
ese
effort.
sentido, yo
Sense,
pienso que para poder
I
ir
believe that
haciendo el
in
reconocimiento de
order
los
to
diferentes grupos del
recognize all
trabajo,
the occupational
debe
groups,
fomentarse también en
there
lo que
must
es la
be
educación
promote
básica de las
in
comunidades.
a
En algún
basic
momento se
education in
habló aquí
communities.
del
We
hacer,
spoke
por
here
ejemplo, que
of
desde la infancia
Ministry
haya
of
conocimiento
Education.
sobre los riesgos del trabajo.
That is
En
important
ese
that from
sentido
the
hay que hacer un
childhood
esfuerzo y una
it
campaña de
have
sensibilización
a
para poder
sensibilization of
incorporar
risk
esos
work.
grupos que en este momento
So we
en la
have to
seguridad
incorporate
social
these
no
groups
cuentan con
that
representación
they don't
y
have a
muchas veces no
representative
conocen
in
sus
social
derechos
security
y no
and they don't know
conocen cómo
their own
acudir
rights
a las
and how
fuentes donde se les puede ayudar,
to go
porque la
to the
estructura
institutions
está,
that may
pero
help them,
el
because the
reconocimiento de
structure,
los derechos y los deberes
we
es
have to
también una
recognize
obligación de las entidades que
recognize all
estamos a cargo
the rights of the
para
workers,
hacerlos y promoverlos en las
to
comunidades.
promote and also to promote them in the
Todos sabemos,
communities.
digamos, el
We all
cambio que ha
know
habido a
the
nivel
change that have
internacional de
been
los actores que
internationally for the
participan en
stakeholders
los
that are
procesos que nosotros
participating in
conocemos.
the processes
Y
that
cada
we
día van
know,
apareciendo más
and each
actores
day
y cada día
more
van
stakeholders
apareciendo
are
las
appearing,
exigencias sobre
and
las
also
herramientas que
the
tenemos que
tools that we
utilizar para
have
el
to
diálogo.
use for
El poder
dialogue,
estructurar algo
the
que no
ability
tiene
to
estructura, valga la
structure something that
redundancia,
does not have
es un
structure
esfuerzo más
is
allá
an
y tiene
effort
que ver con
beyond
una
and is
modalidad de
related to a
participación muy diferente
participation
a la que estamos
modality
acostumbrados. Nosotros
than the
estamos
one that we are
acostumbrados
used to. We are
a
used to
una comunicación por representaciones.
communication by
Sin embargo,
representatives.
cuando se hace una
Nonetheless,
participación abierta,
when there is
tenemos
an
que
open
recurrir a otro tipo de
representation,
herramientas.
we have to use other
Entonces, por
tools.
ahí están estudios para
There
detectar
are
las
some
necesidades
research
a nivel
to
comunitario,
detect
a nivel de los
needs in
lugares
a
donde nosotros
regional
consideramos
level,
que debe investigarse y promocionar
and to
alguna
promote
medida o
some
alguna
measures,
tendencia de comunicación que sea muy
or some
activa
way
y
of
que verdaderamente
communicating
refleje las
that
necesidades de las
are active
personas.
and that really
El
reflects the
problema es que
needs of the
muchas
people.
veces
The problem is that
cuando se hace
several
el
times that
proceso participativo,
when this participatory process is made, this representative
la
process is
intención
made,
y la
the
idea en
aim
el
and the
camino
idea
se convierte en otra cosa. Todos sabemos cuando
it
nos
turns
representa alguien que
doing
hemos elegido, a
something
veces
else.
hasta por elección popular, cuando esa persona
When
habla, nosotros tenemos la
this
sensación de decir,
representative is
ese no nos
speaking,
representa.
we have the feeling to
Entonces,
say
esa
this one is not
ausencia se da
representing us.
porque
This absence is due because the participation in dialogues must be an open line of participation, and all the entities that promote the dialogue, we have to ensure that people are invited to this dialogue, whether they want to organize and have their own representative, or they want to go directly on dialogue. Participation by representation is transforming itself into a direct participation, especially with human rights topics. The variability is such that all the groups of the workers group so big that we have to promote those tools of communication, because several times we go to a dialogue, and then when we have the summary, they add ideas that were not in the original dialogue. So we have to see that all these tool structure, they arrive the most transparently to the decision makers in order to make the adjustment, the needed adjustment, so the rights and differences of the people are respected. Thank you very much, doctor.
Bien, se nos ha terminado el tiempo, pero no quiero dejar fuera esta última pregunta, y más bien la voy a dejar de manera retórica, porque al mismo tiempo nos contesta, pero me va a ser relevante. Nos dicen en el chat, ¿por qué no apostar a la consolidación de los sistemas de seguridad social antes de desarrollar modelos de participación social, o bien junto con ello? Se supone que los sistemas de seguridad social están respaldados en las leyes. Entonces lo dejamos justamente a manera de pregunta retórica. Y con esto cerramos la sesión del día de hoy. Agradecemos mucho el apoyo técnico y logístico en la organización de este evento. Los esperamos mañana a la misma hora. Muchas gracias.